Hello, thank you for taking the time to listen to this presentation on prescriptions for prevention, connecting families to local resources and interventions that address environmental health concerns. My name is Joseph Wilson Jr., and I am a program coordinator at the Region 2 Pediatric Environmental Health Specialty Unit, known as the PEHSU, and the New York State Children's Environmental Health Centers, otherwise known as NYSCHECK. Our main finding is that the prescriptions for prevention, also called the RX for prevention, is a useful tool to address pediatric health disparities. It addresses these disparities by integrating environmental health screenings, evidence-based messaging, and referrals to community resources into routine pediatric care. This slide describes the background for our prescriptions. The motivation for this project was the gap seen between the training health practitioners receive and the guidance they give families on environmental exposures such as mold, radon, lead, and cleaning chemicals. To address this gap, an interdisciplinary team with members from the PEHSUs and NIEHS community engagement corps in regions 1, 2, 3, 5, and 9 was formed to create these scripts. Our prescriptions provide evidence-based action steps and links to community resources. On this slide, we have an image of one of our prescriptions. This prescription is on safer pest control and contains the key features of a script, an evidence-based action plan, and community resources. We have prescriptions on a variety of topics, ranging from PFAS and outdoor air quality to mold and lead. These scripts are more than just a piece of paper handed out at a clinic or community event, but are meant to be integrated into a patient's clinical care. This integration can be seen in a model we use at our center called Screen, Counsel, and Refer. On this slide, we have this model, starting with screening. We screen families for common environmental exposures and other social determinants of health in various settings, such as at a primary care or subspecialty care clinic. We then use these scripts as a tool to counsel and refer. The front of the prescription is used to counsel and consists of evidence-based simple action steps that were created by a team of experts within pediatric environmental health. The back of the script is used to refer our patients to websites, hotlines, local resources, and referrals to community resources when applicable. Here's an example of the prescription in action. A child with poorly controlled asthma enters into our clinic and is screened for environmental health concerns in the home. In this instance, the screener reveals that the patient is living in a rental apartment with cockroaches and other pests, and that they have a landlord who is unresponsive to their repair request. As part of our counsel to the patient and their family, we will give them our prescription on safer pest control and discuss the action steps and local resources on integrated pest management. The script would also include tips for reporting maintenance defects through the 311 system. If needed, we will also provide a referral to one of our community partners, such as seen here, to address any needed home remediation. Our community partners are an essential part of this work, as they also provide additional types of social support services to the family as needed. In this image, our community partner is assisting a family in applying integrated pest management practices in their home. As a result of this work, we have more than 20 prescription topics available in English and Spanish. We also have 2 scripts related to safer cleaning and disinfecting during COVID-19. And these have been translated into 9 different languages. Our partner centers across the New York State network have adapted several scripts to highlight local resources, while the Region 2 PEHSU has created localized scripts for partners in Puerto Rico and the US Virgin Islands. We are also working with other outside partners, including regional PEHSUs and community engagement corps, to localize the resources on the back of the scripts to meet the needs of their communities. In the future, we plan to evaluate the prescriptions, further integrate them into the electronic medical record, and assist other partners in our state and region to localize a variety of scripts for which they can use to screen, counsel, and refer families. Through the creation of these prescriptions and our work towards integrating their use in pediatric care, our goal is to increase the capacity of our health system and other providers to proactively address pediatric health disparities. Special thanks to our incredible team listed here. If you have any questions or ideas on collaboration, feel free to contact me at joseph.wilson@mssm.edu. Also check out our prescriptions by scanning the QR code or visiting the website listed. Thank you for your time.